Dr. Michael Barnes here, board certified psychiatrist. Today I want to go over a little bit about benzodiazepines, but specifically the withdrawal that can come with this. There is a very serious risk of withdrawal here. I have kind of a love-hate relationship with these medications, so let's jump right in. So the names of them, these are four of the common ones. Obviously there's more than this, but Xanax is alprazolam, Ativan is lorazepam, Klonopin is also called clonazepam, and Valium is diazepam. What I meant by saying that I have a love-hate relationship with these medications is that on the one hand, I love that they treat panic attacks really well. If you've experienced a panic attack, you will understand how severe that feels. And to be able to give some people relief from that symptom is quite amazing, since it's very difficult to do. On the other hand, when taken chronically every day, which really I would argue they're not meant to be taken that way, these should be fire extinguishers as opposed to daily use. But in some folks that did take them every day, they will have protracted withdrawal. Withdrawal symptoms can include not just a worsening of the anxiety, but things like shaking, tremor, twitches, increase in heart rate, breathing, sweating, even the GI tract and belly problems can start occurring. So this is, and even worse, if that goes unchecked, it can cause seizures, brain damage, and even worse. So this is something we gotta take real seriously, and it's something that I've helped a lot of folks with. Ideally, if somebody needs to come off of these medications, it should be done in a hospital setting, in a detox center, for example. That way you have nurses who could check vital signs, and you have a doctor who could see you daily and can make little adjustments, potentially through IV or intramuscular or other routes. But if you are unable to go to a place like that and you have to detox in an outpatient setting, that is very difficult, but I'm going to show you a little bit of my take on that. So these are the medications that are from short-acting to long-acting, top to bottom. So we do see this more often with the ones towards the top, but we see them just as much, and me personally, I see them just as much with some of these other ones as well. So I want to arbitrarily for a second, let's just pick Klonopin, since it's just sort of on my mind, I guess, recently. And I'm going to erase these other ones, and I want to show you guys like a potential scenario that people come to me with, okay? So let's say somebody's on it and they want to come off, and they realize that they are on it every day and they want to fight the battle of, trying to come off of this stuff. Let's say they're on 2 milligrams 3 times a day. Okay? Now, you may say, okay, let's chip away. Now, this is a little bit of an art. I'm going to be real with you guys. I think medicine is an art, particularly psychiatry. So this kind of exemplifies that. And the key to protracted withdrawal is to go very, very slow. Let me explain what I mean. You may think this is slow, but I'm going to start here. You can pick one of these doses, say this one. Let's say it's morning, afternoon, and night. And you can decrease this one to 1.75. And you keep these two the same, okay? Just that slight little decrease can sometimes put people in very serious withdrawal. And this is where being in an inpatient center can help, but otherwise as an outpatient, you may say, well, how do you go smaller than that? It's impossible to go smaller than that. Well, there is a way to go smaller than that. Let me show you with something that we do at Mindful Medicine. Is we'll say, okay, let's say dropping from 2 to 1.75 is very difficult. Well, remember that if they drop from 2 to 1.75, that's 7 days a week. There's a way to do it every other day. I say get out a calendar and do Monday, Wednesday, Friday, the 1.75, and all the other days at 2 milligrams. You may say, even that's hard. I did Monday, Wednesday, Friday, I couldn't. It was really, really hard. If that's the case, I tell some folks, pick one day a week. Pick Friday. Friday. Only Friday, you go to 1.75 in this dose. And you sit there until you can tolerate it. Sometimes that could be weeks. More. And this is how a lot of people talk about micro dosing. We talk about micro detoxing at Mindful Medicine.